Hi, this video covers Miss Susan Bowers. Some immediate kind of assessment data I collected from her chart was her height and weight in order to calculate a BMI, which is at a 29.7. Some relevant diagnoses were acute STEMI. She had hypertension, hyperlipidemia, as well as coronary artery disease and osteoarthritis. Some medications she was on included metoprolol, aspirin, heparin, nitroglycerin, calcium, vitamin D, and she also did take a multivitamin as well as ultravastin. From her labs, it looks like she had an elevated lipid panel, elevated troponin, and as well as glucose. And some physical symptoms she was experiencing were chest pain, shortness of breath, nausea, and she was on oxygen. Some lifestyle factors is she does walk 3 to 4 times a week. She doesn't smoke and consumes minimal alcohol. So in addition to the information I was able to pull from the patient's chart, I would try to collect information on the patient's typical daily food intake and portion sizes, assess her readiness to make dietary changes, and assess nutrition knowledge related to heart disease. Some nutrition diagnosis information, I concluded that Miss Bowers would benefit from a nutrition assessment to assess her diet, to provide some education on nutrition strategies for cardiovascular health, and support her long-term health. My PES statement is as follows: nutrition-related knowledge deficit related to lack of information surrounding cardiovascular health-related food intake, evidenced by hyperlipidemia, hypertension, and acute myocardial infarction. In terms of a nutrition intervention, I would recommend a kosher Mediterranean style eating pattern, creating smart goals that would promote the consumption of fruits, vegetables, healthy fats, lean proteins, and a reduced sodium intake. I would also encourage and support the patient to resume walking and kind of keep that activity level up as soon as she's been approved by her physician, or maybe following cardiac rehab if she goes through that. And some ways I might practice cultural humility and competence with this patient would be asking more questions about which kosher practices she follows, what that entails, if she keeps a kosher kitchen, accessibility to healthy kosher foods, and then providing some suggestions for low sodium kosher foods on the go. So in my research, it appeared that some kosher foods that are kind of easier to grab and grow, more convenient, may be pretty high in salt, and with her history with the cardiac issues she's having, trying to find some alternatives that would just be lower in sodium. And I would also seek to be curious and supportive of the patient's dietary needs. So cue off of her and the information she provides about the areas of nutrition that are easier versus more challenging for her. I would provide an infographic on heart healthy eating, and in terms of monitoring, I would seek to track her nutrition intake and adherence to the Mediterranean diet principles, her ability to meal plan, and her LDL cholesterol, blood pressure, and activity levels.